Hello, we are the Association for Child and Adolescent Mental Health, or ACAMH for short.
Well, I think it's already changed. We got a lot of references to the 80s this morning about some of the bad practices in the 80s. Since then, there's been a huge support from the government, for example, in dyslexia. The Rose Report in 2009 clearly indicated dyslexia is a reading difficulty and all the other associated difficulties with dyslexia, and provided funding for courses for dyslexia. So what's going to happen now is more and more teachers are going to be trained to not only identify but to intervene, to have a good understanding of the intervention programs, intervention strategies for dyslexia, and that's increasing all the time. The British Dyslexia Association accredit courses for dyslexia, and that's increased vastly in the last 10 years. And now I think they'll accredit at least over 40 courses in this country and also in overseas. So I think more and more teachers got to become aware of dyslexia now. I've always been of the view that intervention shouldn't necessarily be specialised. I always think that, if good teaching practices can be quite effective for children with dyslexia. The only difference is they need it for longer. Their pace of learning needs to be, you've got to give them more time, and they need a lot of over-learning. So a lot of repetition, a lot of recap to make sure they're consolidated, because they do take longer. So I think the intervention is, the way it's going at the moment, you've got a lot of specialist programs. There's going to be more and more of these. I'm not saying they're going to be good, but there's going to be more of them. But there's also going to be more effective classroom practices, and I think that's what counts. Well, the training they're getting at the moment, the British Dyslexia Association Accreditation Board have got very stringent criteria for anyone who wants to develop a course in dyslexia and wants to get it accredited. And it's so many 100 hours of training with teaching practices, supervised practice and intervention. So I think that's going to be much the same, but there's going to be more of it. I think the UK is probably, I work in many countries and I travel around a lot of countries, and I would say the UK is by far well in front of anyone else, without a doubt. And that includes Scotland.
To be part of the advancement of child and adolescent mental health, visit www.acamh.org.